Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome, listeners, to Feel Better, Feel Great podcast episode 112, The Power of Believing Your Patients. I am Dr. Andrea McSwain. Before we delve into today's podcast content, I want to remind you that while I am a medical professional, the information shared here is intended for educational purposes only. It is not a substitute for personalized medical attention, diagnosis, or treatment. Always consult with your healthcare provider for guidance tailored to your specific health needs. Now let's embark on this journey of health education together. This episode piggybacks from the last episode, which was on anxiety and triggers for panic attacks. As I mentioned in that episode, it's a very sensitive subject, and I want to continue on today with the idea of believing your patients. This episode is a little bit different of a presentation, as I want to talk to you about, one, why I believe my patients, two, how patients have made me think outside the box, and three, why I believe there is a paradigm shift that's happening in medicine or needs to happen. You may also say that one of the reasons for this episode is to speak to other physicians. It was ingrained in us in our training as physicians to learn how to not believe our patients. Luckily, in many respects, I was in the nursing program first, and I was trained to be a patient advocate through the nursing profession. My mother was an RN BSN, and it was very important for patients to be listened to, respected, and cared for. And I was so happy that when I went into the training to become a physician, that I carried that forward, and I treated my patients with love, dignity, and respect. I remember, though, the very first time I saw a patient being disrespected and not believed that she was doing things in her best interest. She was a patient who struggled with her weight, and she had had knee surgery because she had knee pain. Unfortunately, with multiple knee surgeries, each knee surgery became infected. And when I met her, she now had a solid rod instead of a knee joint. The physician came in as an orthopedic surgeon with a resident, and I was a 19-year-old nursing student at her bedside. He told her that at least your weight will be an advantage to you with this situation. And she was destroyed. This woman was very educated. She was incredibly interesting. She had done things that so many people never even had a chance to do. She was creative and wonderful, and I really enjoyed being with her. And I was so upset when she had to listen to that being said to her. And it shook me for many decades later. So what I have to say today is that I believe my patients, and I believe that you should be believed as a patient. So my paradigm includes believing you. About 5 years ago, I had a patient say, "I have a PhD in me." And I thought that was the most poignant thing. And you'll hear me say it because it really has stuck with me. I have a PhD in me, which means she understood what was going on with the details of her body. And it was my responsibility with my knowledge base to be able to help her understand what was going on, be able to determine treatment options for her with recommendations, and have a plan that would help her reduce the symptoms and also the root cause of these problems. I have a PhD in me, and I hope that you say that, and I hope that you believe that, and I hope that as a physician, for those of you that might be listening to this, I hope that you believe your patients have a PhD in them. Because I believe that we should use language that acknowledges people's skill set in how the life that they have lived is now part of the team that they are in to deal with these medical conditions. I believe in reinforcing that belief system that the patient is responsible for their health, that the patient is aware of the information that has gone on in the past. So oftentimes it's difficult to discern the true problem or the root cause of the problem because patients have been told, oh, that part of your history doesn't matter, or that's not a big deal, or that wasn't really what happened. And I think that leads to a difficulty for people to believe in themselves as patients and value things that matter that have happened to them in the past. So remember, I have a PhD. Second of all, third of all, whatever we're at, the patient, you, and believing the patient means that they have an active participation in decisions in the treatment plan. So that is very important. I will go on to talk about that a little bit later. But then trusting patients. So my patients make me think outside the box. I say everyone has a paradigm. Everyone thinks in their own framework. But my paradigm means that I believe my patients. And that means that when you say something, I'm going to believe it. And I encourage other providers to believe what people say too. I remember a while ago, I think I was a first year resident, and a woman came into the clinic and she had a herpes virus outbreak on her gluteal region. And she said that she got bit by a dog and this is why she had the outbreak. And I remember repeating that information to the residency director and hearing the laughs that came from other people in the room when I said this. Now, I do understand that dogs do not, well, first of all, dog bites are quite foul. They're loaded with a lot of bacteria, and it's very difficult for people to not get infected from a dog bite. Secondly, it's a very stressful physical event that could lead to a herpes outbreak that very well could have connected the pieces together. And by connecting the pieces, I feel like that really helps take some things that have happened to people and put them together so we can actually look for the root cause. I will tell you that I did 10 years later see a patient who had trigger point injections that then led to a shingles outbreak in that area. And so just as a side note, those are very similar viral outbreaks, and they are triggered from stressful events, among other things like diet and lifestyle pillars being compromised. So, and then a lot of people have that particular virus. So there's a lot of things that happen when you have something that has a controversial virus around it or a controversial diagnosis that people will often add the fault to the patient and also disconnect the idea that there could be some relationship between the symptom that the person's having and the background mediators that may have led up to that symptom manifestation. So I have to think outside the box for my patients because I have seen some things that really also just mean a matter of miscommunication. As a resident in the emergency room, I was I was a med student. I was following this doctor in to speak to a patient, and the patient came in, I think, with a headache or abdominal pain, and it was addressed in the ER, and the person was ready to go. This person came in. I guess I was there for a while that day. This person, they came in, they were dressed in business professional clothes. They were smart, kind, just seemingly very, very normal person, and had never really been to the emergency room. So they really weren't familiar with this place. And at the counseling of this patient towards the end of their visit in the ER, they were instructed by the attending physician to remove their IV. Now, the attending physician did not mean exactly what they said. They meant to say that someone will come in and remove your IV for you. So they meant to tell the patient that part of their process of them being discharged was that the IV would be removed from their arm. Well, we came back a few minutes later and the patient had pulled the IV out of her arm and there was quite a bit of blood around. She had the sense to stop the bleeding by putting pressure on it. And what happened is she was told that was outrageous, but the patient looked very bewildered by that. And I then recounted that the exact instructions for the patient was to pull out her IV. So she was mocked. And that was very unfortunate because she had actually done what she had been told because she hadn't ever really been in the ER. She didn't know that was not something she was supposed to do. And while it seemed like that would be reasonable because she was following the explicit instructions of this provider, she pulled out her IV. And I really feel like it was a big disservice for the attending physician to not recognize that they had actually instructed this person to do that. That person had followed them, which seems also like, why would someone pull out their IV? But they did what they were told as a patient, and then they were ridiculed. So I think I belabored that circumstance quite a bit. But what I really wanted to show is that patients often do what they're told. They focus on compliance. And then I want to go into times that I have been a patient and what has happened to me. I'm a functional medicine doctor. I'm a holistic medicine doctor. I'm an osteopathic physician. I'm a gynecologist, obstetrician. So when I come into serving as a patient support person, I come in with a fair amount of information, but that is not my job when I'm sitting and serving a loved one of mine to be their support. So I did have a time where I went with a friend who had knee pain. He did go in to talk to his primary care doctor, and I did make a suggestion that maybe he should be recommended to go to an osteopathic clinic so that they could work on his knee problem from a muscular-skeletal perspective. And the doctor quickly turned to say to me, "Is that what you read on Google?" And what I did not say to her is, "No, that is what I treated in my clinic this morning." I was a little shocked, to be honest, that that was how another person was being treated with something that has evidence-based medicine as a possible treatment plan. And I was hoping her feedback would educate the patient, who was my friend. That did not exactly how it went. The other one that was quite disturbing as a patient support is putting my child in the hands of a clinic, primary care clinic, and being told that she needed an antibiotic for streptococcus. She didn't test for streptococcus. It tested negative. She didn't have a fever. The doctor said that she was listless, although she was running around the room, and that if I did not return her to the clinic for evaluation in 24 hours, that they would report me to Child Protective Services. So this is a child who has a virus that she recovered from very quickly, and luckily all of her recovery happened quite quickly after this visit, and there were no additional steps taken towards me. Although I didn't understand that such a severe measure would be taken against someone who has an afebrile child, meaning a child without a fever, who's running around, who's not positive for strep. So I can only imagine when people come into my office with similar stories, the torturousness that it is to actually go to a place where people do not believe you, especially when you have something that's unusual. And to be honest, the narrow box that most doctors are practicing out of means you're going to be outside of their box with your symptoms, with your history. And so if you're not falling within the confines that they understand, then how are you going to be able to care or receive care from them, rather? So receiving care from someone requires that they believe you. At least that's what I think. And secondly, it requires that they have to believe you in a way that helps put the pieces together of what is actually going on. I have talked about other patients who, in my other stories and my episodes, where there weren't even questions that went on to understand what the person was actually going through so that you could get enough background information to then paint a picture to understand the current symptoms. So that is an important dynamic in that you need to be trusted as a patient, but you also need to trust yourself. As I tell my patients, you don't need to trust me. You need to figure out what I'm saying that works for you. You need to trust yourself. And it's not my body. So this is very important as well. I treat my patients with a respect and dignity that they deserve by recommending to them that they figure out how to trust themselves and recognize that it's their body and they need to make decisions, right? So that's the way that they're actively involved in their care because they're the ones that have to do the work. And so often the healing process requires that patients really have to do a lot of work at home to recover. Something that might seemingly have started in the last 4 or 5 months may have actually been brewing for the last 10 to 15 or 20 years. So there is a reversal that has to happen, which means there has to be a lot of work that's done at home. And I have to be the one to recognize what I think is a good plan in bringing in a lot of principles of medicine, but they really need to be the ones to implement that plan. And so they have to value that plan. And that is very important. I do believe also that there needs to be a paradigm shift in medicine. Remember, medicine, you could say is quite old, ancient wisdom, but conventional medicine is rather new. And if we look to old paradigms, we might see that the story of doctors not washing their hands going between the morgue and the obstetrics unit. So Dr. Lister, recognized this as a problem. And what was happening in some hospitals was a shift in the morning for some of the doctors. They would be in the morgue, and then in the afternoon, they would be in the obstetrics unit. And some of the doctors would be in the obstetrics unit in the morning and the morgue in the afternoon. Well, those doctors working in the morgue in the afternoon carried pathogens on their hands to the obstetrics units, and there were significant deaths related to mother and child. That is an old paradigm. It took a long time to switch in medicine because we could not see those microbes, and so they did not exist. It didn't matter that the babies and the mommies were not living in the afternoon. And I think that is a matter of believing your patients that was a problem. Additionally, we have seen people give, many medications that are not applicable to actually their health and well-being, such as arsenic to heal. There are old paradigms in medicine. And I think one of the old paradigms in medicine that have to shift is that patients are told what to do. And another old paradigm that needs to shift is fear is a motivation for getting your patients to do what you think is best as a provider. I think that medicine is based in love. And when people are afraid, and that is their motivator for choosing a treatment plan, I believe that is an old paradigm shift. And I believe that is an old paradigm. And paradigms such as these lead to fear-based responses in the body as well. But love, I believe, is the paradigm that we need to shift in medicine. We need to shift to a paradigm of love. And that means a team approach that recognizes that the patient is in charge of their body, it also holds the patient and holds all of us accountable for the lifestyle medicine, the medicine that we do every single day in our lives. Whether it's what we choose in our eating practices, how much we're moving and how we're moving in our bodies. Are we finding joy when we move? What kind of relationships and how do we handle those relationships? What about quality sleep? And also handling stress so it doesn't become chronic and body depleting. Those are all the things that need to happen when we accept love as a paradigm in medicine. And it also increases our accountability as individuals, as patients, and as physicians towards looking at this concept of healthy at 100. So these are the things that I would suggest when we look at how to turn in an old idea of telling someone what to do, of having a model where someone is right and someone is wrong, of having an idea where someone tells someone that this is how it's going to be because of some oftentimes antithesis to evidence-based medicine and research, but fear-mongering that then provokes a decision for the patient. So those are the things that I think need to be adjusted as paradigm shifts. And that kind of leads into another term we use in medicine called compliance, or what people often hear is non-compliance. I remember being 26 and looking at my chart, because it was a paper chart in those days, and was outside the door of my room. And I looked at the chart, and the first thing it said is, in really big red letters, non-compliant. And I thought that was so interesting because, first of all, it was very big red letters. Second of all, you could read it and see it if you're walking down the hall. And third of all, when I looked at it and had it in my hand and the doctor approached me, he said, "You can't look at that." And I thought, that's insane. Of course I can look at it. It's who I am. It's my chart. And so I thought it was very funny, though, that also I was labeled non-compliant. Not because I didn't care about my body, not because I didn't want to be healthy, but because I had made a decision different than what the doctor had told me to do. I did not value what that person said. I didn't understand the details of it. And honestly, it wasn't the path that I wanted to have in my own healthcare. I wanted to do things that made me more accountable in my lifestyle medicine practices, that made me more accountable in my day-to-day, that helped me understand what decisions I was making for my body and what the consequences were of some of those decisions potentially. I didn't really appreciate being labeled non-compliant. In fact, I found it quite comical because I didn't even know that I was non-compliant. And so I really laughed. And also then I didn't really care to listen to what the doctor said because I had been labeled, quite literally, judged, most definitely, and completely disconnected to a relationship with that person because they didn't even really hear what I was saying. And I don't think they cared to hear. So those are some things that I took from that word on my chart. You might know or not know that more than 60% of people are actually non-compliant with their traditional medicine protocols. And so you're not alone if you're making decisions for what to do and not telling your doctor what you're doing. And that is very difficult because a lot of times people are in a hard spot. They might find they're taking a medicine. It makes them feel really, really bad. So they stop taking the medicine and then they don't tell their doctor. Now their doctor is in good faith putting them on a medication to help them either improve symptoms or a medical condition. But now the doctor believes that they are on this medication and they're not getting results. Well, however you want to phrase that. And so I think it's really important to recognize that it's a chicken egg problem there because one, as a person, you don't really feel the need to be judged by someone. And two, as a doctor, you don't even understand the picture of what's happening because there is non-compliance. And we've definitely had that in the practice. I think that in my clinic, when I see it sometimes, is people often don't value like the supplements, because a lot of people think a supplement is a supplement is a supplement, and that couldn't be further from the truth, because a lot of things are on the market that are completely capitalist based, and supplements that are very effective, that I've vetted clinically, that I know how they're going to work. I'm very aware of the process of them. I'm aware of the details. And the patient has chosen to use another company and their supplements, and I'm not getting the results. So not that the person is non-compliant. Oftentimes I see this actually with lab values. So when we do labs for like B12 or D, for example, when I have done those in the past and the person hasn't used a supplement that has been recommended, I sometimes see that those values don't change. Where I know when I use them, they are going to change. And I haven't impressed upon the patient enough information about the quality of materials that they're using to help support their needs so that those micronutrients can be improved so that they can feel better. So there's been sometimes a disconnect in my clinic when I believe my patients, but they choose to take a different route, and that's also their decision. But sometimes we can see that with objective findings in the labs. And so is that person non-compliant? Not particularly. They just took a different route. And luckily, in circumstances like that, we can, shift gears, and I can explain the value of these things better, or I let the labs speak for themselves with some of those micronutrients. Again, B12, D, omega-3s, I've seen them quite often, lipids profiles, thyroid profiles, adrenal profiles, all those things that there's a certain profiling that needs to happen to make those recommendations, to have a lot of finesse and detail. And when they are done in a certain manner, they can have a lot of benefit in a short amount of time and become quite efficient. And so that idea of, okay, well, that's your body and those are your decisions and they're respected. That's really important to having people understand that it is their body and it is their decision. And so there isn't an issue of non-compliance, but sometimes there's definitely a conversation about value or more education. And as a person who believes their patients, I think that is sometimes the area that needs the most work, is that communication of sharing information in both ways. So, with that, and kind of derailing a little bit with this idea of what does compliance mean or non-compliance mean, I just kind of want to take you back to this idea of a paradigm shift in medicine to believing your patients, working potentially with a provider who thinks inside their paradigm, but that includes believing you, and learning how to believe yourself, and also learn how to ask questions, to find out more information, to know your resources, know what you need to do to take action in your own life, because really the work of the patient is with the patient so often, and that's you. And so by believing you as a patient, it then puts the responsibility of your health on you. And so you definitely want to gather information from your providers. You definitely deserve the respect and consideration of making your own decisions, to have autonomy and independent decision making as part of your healthcare practices. And so I want to ask you, what do you want from the healthcare providers that you work with in this area of believing? So thank you very much. I hope that today provided a different understanding of paradigms. I think I very much appreciate your time. Please share this with others and believe in yourself.